So today we're going to start another important topic which is actually related to the periodontology. So let's start it. Bismillahirrahmanirrahim. So basically it is the microbiology of the periodontal diseases. In this chapter we will study about the microorganisms which are involved in the periodontal diseases, the formation of biofilm basically. Okay, then we will discuss about also the virulence factors actually. Okay, so now moving towards basically little bit to know about bacteria. What is bacteria? It is actually a single form of word which is bacterium. A single form is known as bacterium. It is simplest microorganism we know it. It has been existed on earth for a very longer period of time and has the most abundant type of cells still now. It actually replicate very quickly and adapt to the environmental changes very rapidly also. Now, it has a cell membrane, and this cell membrane is a very tough protective layer that actually encloses all the bacteria. Cell membrane is very important. According to that, we actually identify and classify bacteria. For classification of bacteria, we use a technique which is known as gram staining. Gram staining is a technique that actually make difference in physical chemical properties of cell membrane, and the probability of cell membrane appears to be either red or purple in color either in microscope. You can see here is a gram positive and gram negative bacteria. Okay, now moving towards the classification of oral microorganisms. We have actually prokaryotes, spirochetes, and mycoplasms and eukaryotes. In prokaryotes, we actually study about the cocci and rods. They are actually divided in gram positive, gram negative. Actually, then we have actually further division which is actually positive gram positive faculated anaerobes and obligate anaerobes. Faculated anaerobes are those bacteria that actually can grow without or with oxygen, but obligate anaerobes are those bacteria that actually needs the absence of oxygen to grow. In cocci we have streptococcus. Faculated anaerobes we have actually streptococci, and in oblique anaerobes the cocci is actually peptostreptococcus and Peptococcus. In negative, we have actually again has been divided in faculated anaerobes and obligate anaerobes. Neisseria, which is faculated anaerobes, and Brahmila. Then we have obligate anaerobes in Velonella. Then we have rods, gram positive, which is faculated anaerobes, and obligate. In faculated anaerobes, we basically have actinomyces, propionibacterium, rotia, lactobacillus. Then you have eubacterium and bifidobacterium. In gram negative, which is actually actinobacillus, capnocytophaga, uh, campylobacter, Echinella, and Haemophilus. In obligate anaerobes, we have rods like for aja. These bacteria are very important because these are those bacteria that are actually involved in the basically in the periodontal diseases. Porphyromonas, Provatella, Bacterioides, Physobacterium, and Selenomonas. In spirochetes, which is also very important, we have mycoplasm, and in gram positive we have mycoplasm, and gram negative we have spirochetes of which is acute necrotizing ulcerative gingivitis and tropinoma also. In eukaryotes we have in gram basically candidata and ant amoeba. Okay, now basically moving towards the survival of bacteria, how the bacteria survive in the oral cavity. It is basically a dynamic equilibrium that actually exists between the adhesion forces of bacteria and the removal forces by that originate through swallowing when the patient swallow or masticate or blowing the nose. Tongue and oral hygiene implements are very important. The washout effect of the salivary, nasal, and clavicle fluid outflow means the saliva plays another important role. Up till we study about the swallowing, mastication, and tongue and oral hygiene implements. Then we have come across the salivary flow, the washout effect of salivary flow, nasal and clavicle flow, fluid outflow. The action motion of the cilia, which is nasal, and sinus walls. Most organisms can survive in the oropharynx even when they adhere either the soft tissues or the hard surfaces like teeth, dentures, and implants. The ability of bacteria to adhere to its host is crucial because it is important to induce the diseases such as gingivitis and periodontitis. So, adhesion is very important. Now, moving towards the ecosystems or niches in the oral cavity. Ecosystems. On the basis of their physical and morphological criteria, the oral cavity has six major ecosystems or called six niches with distinct ecologic determinants. It is intraoral inside the mouth, supragingival, and hard surfaces like teeth, implants, restorations, and prostheses. Then we have subgingival regions adjacent to a hard surfaces like including the periodontal peri-implant pocket where its clavicle fluid, the root cementum or implant surface and the pocket epithelium. The buccal palatal epithelium of the floor of the mouth, dorsal of the tongue, tonsils and saliva. These are actually we have niches. Supragingival, subgingival. Then we have discussed actually. Then we have discussed about buccal, palatal area, floor of the mouth. Okay. Then dorsal of tongue, tonsils and saliva. These are six niches that should be remembered.